All right, so I was told that I speak very funny, and I'm not going to speak in franglais for you, so I'll try in English, but with 3 hours sleep, the ADHD thing is probably obvious right now. We can affect lives every single which way possible. And the ones that I'm going to really emphasize on today are the way that we would work structurally with orthotropics, orthopedics, and orthodontics. And yes, everything that you've been talked to already for the past few days, I had to take out of my presentation because everybody did such an awesome job. We're going to talk about the way that the bite actually works. So we actually can go ahead and change the way that the bite is, and by changing the bite, we're going to change the whole body. 1 tooth at a time if need be. Chemically, I have an alternative practice. Obviously, I was mercury-free. Everybody would come to me, but the chemical aspect was not the only aspect. There were so many other things that the patients had that were wrong that I had to learn how to help them. And we obviously, I'm here thanks to Xylitol, thanks to Xlear, because of the nutrition aspect and the incorporation of Xylitol into the practice. Emotionally, I have found that it has given great satisfaction both to myself and my patients because I have given them back their quality of life. And at the same time, there are other benefits that I hear about. Spiritually, I give them back balance. I get balance literally. So these changes are actually going to help the body's need to not compensate anymore, and that's what I do. I like to tell patients when they walk into the practice, the teeth are the tip of the iceberg. Now, patients get what I'm going to tell you. A lot of dentists don't, and that's the hard part, is we're so trained with blinders on that it might be a hard stretch for you to understand this, but there's a whole body attached to the teeth. And like this picture, if you don't get it, then you're going to miss it, and you're going to miss everything else that happens. I had the pleasure of being picked. I was one of 11 people in the world to be picked for a master's study research at Tufts. Dr. Gelb hails from. And my study was how to change the vertical dimension, if the vertical dimension of the bite will change the way you walk. It was not statistically proven, but we did show that changing dental midlines will actually change the way that you walk. And this is my corridor at the office, and the lines are still there because it is part, even though I didn't prove it, it still does work. One of the things that's most important is that we realize that everything changes, and that the body basically has a chain, if you will, and when you look at it, there's a link process that occurs. The teeth are part of this link. Everything is part of the chain, and it's the weakest link that's going to break down, and that's where you're going to have your first failure, if you will. So what I do is I use a slide. This is the homunculus. I don't know if any of you know this. This is basically your brain. So what I tell patients, 65% of your brain is computed to your head and your face. Of that, 45% is the trigeminal nerve. I call that the big mama nerve, the fifth cranial nerve. And that is the one that innervates the jaw joint. So I want you to start thinking. We saw the tip of the iceberg, we saw the teeth, right? So now we're going to go step by step. This is my little slide I had to put in there that we actually also do treat patients with motion disorders and Tourette's. And this is the pioneering work by Dr. Stagg and his cohort, if you will, Dr. Tony Sims in Virginia. All right, so if we start with the teeth, and we know that by a tooth, you can actually go ahead and change your brain. Now let's go on to the rest of the body. We talked a lot about airway, we talked a lot about posture, and then by balancing the forces and changing the bite, you could actually affect the way the spine works, or the cervical posture. And remember, in this cervical spine, there are nerves that are going to innervate the rest of the body. And then if you see how we have muscle tension, the teeth are affecting the jaw is affecting the cervical spine, and then down it goes. And now what will happen is you'll see we have compensatory changes that occur all the way down to the body. The chiropractors understand this. They can call it descending or ascending. You can have something that happens in your mouth that will affect the way your feet and toes work, all the way to something at your toes that will affect the way that your bite is. This is an all-uncommon sight. This guy is not wearing a handbag. And you'll find that he has a total distortion, and this is how his body is compensated through the time. What I found when I was doing my research is that we will always seek as humans to have a levelness. You don't see a crooked horizon. You don't see a crooked ocean. The eyes, the ears, and the bite will always be level. And that will create balance. So how does it work? Dr. Gelb talked about swallowing and breathing. Breathing, obviously, we talked about. But what we can do too, you have the orthotropics and orthodontics, etc. But when we talk about breathing with the oral appliances, you could actually go ahead and change lives by being able to have the patients breathe. But one of the things that's important to understand is, as Dr. Gelb was saying, the extractions and the way that society is going with nutrition, we don't have the room anymore in our mouths. So that would be why, as a general dentist, I would say the dental physician, I would work with all these other doctors that help me create the whole body healing, if you will, for these patients. So why am I here? Well, Xylitol thought highly enough of what I do to ask me to come see how I integrated Xylitol into my practice. It's everywhere. Every single way that you can think of having it, in gum, in paste, in solution, in all different ways, I have it everywhere. At the front desk, in the back, I have in the rooms, on the shelves, in the cupboards, everywhere. And this is a comment that I think that everybody should go back home. If there's one thing that you remember to tell your patients, is after 45 minutes, 50 grams of sugar, so 1 can of soda, will actually change your immune system by 90%. So you're prone to get every single bug out there. And then with oral, for sleep apnea patients, I would go ahead and I would advocate, obviously, the rinses. I find that there's less inflammation, and obviously there's more response for patients who have GERD, which is another symptom of sleep apnea. And the TMD patients, I do a lot of head, neck, and facial pain. So TMD patients, they have very limited opening and use orthotics. Again, this is some part of changing the bite all the way down to the toes. And one thing I'd like to see Claire do is a non-sticking gum to the orthotics. So this is the most, I think, important part with the connections of what I do. Not only do I do mechanical, structural, functional, etc., but there's an obviously big spiritual connection to the whole thing. I think I've been very blessed. I think God has put me on this mission. And that's my juice. That's my passion. I really love it. Rhoda was the educator who persevered and made me write this, and I won. I was amazed. And this is something I think that's really cool, that we should be dental physicians. And hygienists, you are. I consider you to be my co-therapist. We do this together. We are meant to do this together. I cannot do everything. I like to think that I try, but I can't. And optimal health is what we really need to attain. And as dentists, we're the only ones in the world that actually can change the whole body. So it's not drill, bill, and fill anymore. And thank you. Thank you, guys.